Good morning, Moga. Good morning. This is a Sunday morning, so I am sure it's very difficult to sit and study on a Sunday. Okay, so where everyone, the entire world is happy outside. They were enjoying the Sunday, and we were studying. Yes, I can understand your problem, but once you clear this, once you go out of this step, so that is a next level for your life, and from there you can push yourself to a greater height. Okay, so I think friends are joining, guys. Good morning. So shall we start? So shall we start the today's session? Guys, shall we start? Yes, okay. See, fine. So before going into the today's session, okay, next 5-10 minutes, just we'll discuss about what has happened yesterday, and this is purely a question-based session. I'm just going to ask few questions. Whoever is available on the line, just answer, and whoever is joining the class, let them join, so that we will start the class in another 5 minutes. Okay. So, can anybody tell me what is the action of gluteus maximus? What is the action of gluteus maximus, guys? What is the action of gluteus maximus? Yes, Mugundan. Yes, it is an extension of the hip. Very good, Anashwara. Very good. Okay. So yesterday I said whenever there is an muscle which is causing extension of the hip, it also causes lateral rotation of the hip. Very good. It also causes lateral rotation of the hip. Very good. And which muscle weakness leads to Trendelenburg gait? Which muscle weakness leads to Trendelenburg gait? Yes, guys. What is a muscle? Which muscle weakness leads to Trendelenburg gait? Very good. It is gluteus medius and minimus. Very good. And what is the nerve supply for gluteus medius and minimus, guys? What is the nerve supply for gluteus medius and minimus? Yes, what is the nerve supply? Yes, very good. It is superior gluteal nerve. And yesterday we saw that superior gluteal nerve also supplies one more muscle, that is called as tensor fasciae lata. That is called as tensor fasciae lata. Okay, that is called as tensor fasciae lata. Okay. Okay, fine. Can anybody tell me where is tensor fasciae lata gets inserted into? Insertion of tensor fasciae lata. Okay. Yes, guys. Anybody? Where is tensor fasciae lata gets inserted into? Tensor fasciae lata gets inserted into, where does tensor fasciae lata gets inserted into, guys? Yes, it is inserted into the iliotibial tract. Very good. It is inserted into the iliotibial tract. Okay, so we know that iliotibial tract is nothing but a condensation on the lateral aspect of the thigh. Okay, it is nothing but the condensation of the fascia lata. It is nothing but a condensation of the fascia lata. My now next question is, where does this iliotibial tract gets inserted into? Where it is attached into? Can anybody tell me where iliotibial tract is attached to? Okay, anybody? Where iliotibial tract is attached to? Okay, so proximally, if you see, iliotibial tract is attached to the iliac crest. It is attached to the iliac crest. Where it is attached to distally? Where it is attached to the distal attachment of iliotibial tract? Anybody? See, I hope you know there is a bone called as tibia bone. So this is the proximal part of the tibia bone. This is the proximal. No, Monisha, it is not tibial tuberosity. Please remember, in tibial tuberosity only one structure attaches, that is ligamentum petae. Monisha, it is not tibial tuberosity. Okay, so we'll just see what is there in the proximal tibia. So if you see the proximal tibia, so in the center of the anterior most aspect of the proximal tibia, you have this tuberosity. No, Anashwara, it is not lateral malleolus. This thing I haven't told you yesterday. So this is one important MCQ topic that can come. So this is tibial tuberosity. This is fibula. Okay, if you have fibula, I hope this is the lateral side of the fibula, and this is the lateral side of the tibia, and this is the medial side of the tibia. Okay, so this is called as the lateral condyle of the tibia. Okay, this is called as what? This is called as the lateral condyle of the tibia. This is called as lateral condyle of the tibia. In the lateral condyle of the tibia, okay, so there is an tubercle. Okay, there is a tubercle here, and this tubercle is called as Gerdy's tubercle. That is called as Gerdy's tubercle. What is this tubercle called as? This is called as Gerdy's tubercle. So this Gerdy's tubercle is the one which gives attachment for the iliotibial tract. So iliotibial tract is attached to Gerdy's tubercle. Okay, it is attached to iliotibial tract is attached to Gerdy's tubercle. Okay guys, so this is the answer for this question. So tensor fasciae lata is inserted in the iliotibial tract. Iliotibial tract is attached to Gerdy's tubercle, which is a part of the proximal tibia, Okay, fine. See, we have discussed a lot of things around the lower limb yesterday, and previously we discussed about the upper limb. Can anybody tell me what is the test or Igawa's test is used to check which nerve? Igawa's test is used to check. Okay, Igawa's test is used to check which nerve. Very good, Anashwara. It is for ulna nerve. It is for ulna nerve. Very good. And what is the pen test used for? Pen test is used for which nerve? Pen test is used for which nerve, guys? It is median nerve. Yes, Adira, it is median nerve. Excellent, guys. Can anybody tell me pen test checks which muscle? Which muscle is checked in the pen test? What is the muscle that is checked in the pen test? Yes, very good. It is abductor pollicis brevis. Very good, Anashwara. It is abductor pollicis brevis. Okay. And can anybody tell me what is the content of anatomical snub box? Yes, what is the content of anatomical snub box, guys? What is the content of anatomical snub box? Okay. Yes, very good, Anashwara. It is radial artery. It is radial artery. It is radial artery. Okay. So we have discussed these things in the previous classes. Okay. So I think you would have done the questions well. Okay, yesterday they would have given you the questions. I think you must have done it well. Okay, so without wasting much of the time, we'll go to the today's topic. Before going into today's topic, one thing I want to clarify. Yesterday, I think Anish, I think he raised a doubt. I think his doubt is clear. Yes, it is correct. So if you see the division of the functional segment of the liver, okay, on the left side, these segments are called as the lateral segments. This is called as the lateral segment, okay, and this is called as the medial segment. So please correct in the notes. So this is called as a left superior lateral segment. Okay, so this is called as a left superior lateral segment. Okay, so this is called as a left superior lateral segment. Okay, so 2 is the left superior lateral segment, 3 is the left inferior lateral segment, and 4 and 1. Okay, 1 is the caudate lobe. Okay, so the number is not mentioned here. 1 is the caudate lobe. Okay, so the caudate lobe and the 4th are nothing but the medial segment. They are the medial segment. So this is the medial segment. So please kindly correct it. Sorry for this mistake. Okay, so this is the medial segment. Okay, and also yesterday when we were concluding the class, we were discussing about the development of the liver. Okay, I'll just give a recap for it. Okay, so I'll just give a recap for it. Okay, I hope you know there is a structure called a septum transversum. Okay, so there is a structure called a septum transversum. What is septum transversum? Septum transversum is a mesenchymal tissue between the primitive thorax and the primitive abdomen. Okay, so there is a mesenchymal tissue, or there is a mesodermal part which is between the thorax. Okay, between the thorax and the abdomen. So if you take this is thorax, below the thorax you have a septum which is called as the septum transversum. Okay, so this septum transversum is a part of intra-embryonic mesoderm. It is a part of intra-embryonic mesoderm. Septum transversum is a part of intra-embryonic mesoderm. It is a part of intra-embryonic mesoderm. Okay, so what happens is from the foregut, from the distal part of the foregut, if you take the distal part, let us consider this is the distal part of the foregut. This is the distal part of the foregut. Okay, so an outpouching starts. That outpouching is called as an hepatic bud. Okay, on the right side an outpouching arises. This outpouching is called as an hepatic bud. So what is this bud? This is called as an hepatic bud. Okay, so when the hepatic bud arises, I'm sure the foregut is a derivative of endoderm. The foregut is a derivative of endoderm. Okay, the the epithelium lining of the foregut is a derivative of endodome. So from the endodome you get this outpouching. So this is hepatic duct. So what happens is soon this hepatic duct divides into two portions. Okay, soon this hepatic duct divides into two portions. So one portion is called as pars cystica, another one portion is called as pars hepatica, another one portion is called as pars hepatica. So what is this? This is called as pars cystica, this is called as pars cystica. And what is this portion? This is called as pars hepatica, this is called as pars hepatica. Okay, so this pars cystica enters into the septum transversum. Okay, it enters into the septum transversum and it ramifies within the septum transversum, so leading to the development of liver and the gallbladder below. Okay, so the pars cystica gives rise to the gallbladder, and the cystic duct, okay, and the pars hepatica gives rise to the parenchymal portion of the liver, okay, or the secretory portion of the liver. Okay, so pars hepatica gives rise to the parenchyma of the liver, it gives rise to the parenchyma of the liver. Okay, it gives rise to the parenchyma of the liver, and the septum transversum gives to the supporting or the connective tissue of the liver, supporting on the connective tissue. Okay, so supporting tissue or the connective tissue of the liver. It also gives rise to the reticuloendothelial system, of the liver. Okay, it also gives rise to the stellate cells of the liver, stellate cells are also called as Ito cells, guys. Stellate cells are also called as Ito cells. Okay, stellate cells are also called as Ito cells. Can anybody tell me what is the function of stellate cells, guys? Guys, yes, anybody? What is the function of stellate cells or Ito cells? Very good. It is the cell which is responsible for vitamin A synthesis. Very good. It is a cell which is responsible for the vitamin A storage. Yes, very good, guys. But what happens is when the Ito cells, changes their nature. Okay, whenever there is an insult to the liver, suppose a person is consuming lot of alcohol. Okay, this alcohol goes and irritates the liver. When the cells gets irritated, they change their nature, they become myofibroblast. Okay, they become myofibroblast. When they become myofibroblast, they lay a lot of collagen, resulting in fibrosis of the liver, and this fibrosis of the liver is called as the cirrhosis of the liver. Okay, it is called as cirrhosis of liver. I hope you know there are different types of cirrhosis: micronodular cirrhosis, macronodular cirrhosis. I am not going into the details of that. Pathologists will discuss more about that. But main thing is Ito cells. When they change their nature, usually their function is to store the vitamin A. Yes, accepted. But when they change their nature, they become myofibroblast. And this myofibroblast will form lot of fibrosis, resulting in cirrhosis of the liver. Okay, okay, fine. So with this we'll move to the today's topic, that is pancreas. Okay, so pan means if you see the pancreas, pan means all. Okay, kriya means flesh. So the entire pancreas is like a fleshy material. Okay, that is why it is called as pancreas. Okay, now if you take the pancreas, where the pancreas is situated, the pancreas occupies. Okay, yesterday we saw about the quadrants of the abdomen. So here the pancreas occupies the umbilical region. Okay, it also enters into the part of the epigastric region. Okay, it also enters into a small part of the epigastric region, and also it occupies the left hypochondriac region. Okay, so these are the areas which are occupied by the pancreas. If you take the pancreas, guys, pancreas has got the following structure. It has got the head. Okay, it has got the neck. Okay, and it has got the body. If you trace the head, the lower border of the head forms a projection. This projection is called as an uncinate process. What is this projection called as? This is called as uncinate process. So this projection is called as uncinate process, guys. and pancreas forms the head, and this portion is called as the head of the pancreas. Yes, this is called as the head of the pancreas, and this portion is called as the body of the pancreas. This is called as the body of the pancreas. The junction of the head of the pancreas and the body of the pancreas, this portion is called as the neck of the pancreas. This is called as the neck of the pancreas. This is called as the neck of the pancreas. This is called as the neck of the pancreas. The body ends in the tail of the pancreas. The body ends in the tail of the pancreas. Okay, so this is called as the tail of the pancreas. This is called tail of the pancreas. Okay, this is called as the tail of the pancreas. So this finishes the parts of the pancreas. So pancreas has got head, it has got neck, it has got body, it has got tail, and it has got uncinate process. Okay, so if somebody asks you pancreas is an peritoneal organ or an retroperitoneal organ, the answer is it is mainly an retroperitoneal organ. Okay, so pancreas is mainly an retroperitoneal organ. It is mainly a retroperitoneal organ. Okay, except for the tail of the pancreas, except for the tail. Okay, except for the tail of the pancreas, which is an intraperitoneal structure. It is an intraperitoneal structure. It is an intraperitoneal structure, and this tail of the pancreas lies within a ligament called as lineorenal ligament. Okay, we will discuss about this ligament when we come to the spleen. So this ligament is called as lineorenal ligament, and the tail of the pancreas lies within the lineorenal ligament. Okay, where it lies? It lies within the lineorenal ligament, guys. It lies within the lineorenal ligament, and because of its location within the lineorenal ligament, the tail of the pancreas alone becomes intraperitoneal in nature. Okay, so these are all the parts of the pancreas. We will just see what are the structures which are related to these parts. Okay, so when you see the pancreas, okay, if you see this picture, okay, so the entire pancreas, okay, the entire pancreas from its head, okay, from its head to the neck and to the body, okay, from the head, neck and to the body, it gives attachment for a peritoneal fold here on the anterior surface. Okay, on the anterior surface, if you see, it gives attachment for a peritoneal fold. That peritoneal fold, which is attached to the anterior border or the anterior side of the pancreas throughout its length across the head, neck and body, is called as the transverse mesocolon. So what is this, guys? This is called as transverse mesocolon. Okay, transverse mesocolon is a part of the large intestine. It is an intraperitoneal portion. Okay, so transverse mesocolon transverse mesocolon connects a transverse colon. Transverse colon is a part of the large intestine. Okay, so this transverse mesocolon is attached to the anterior border of the pancreas. It is attached to the anterior border of the pancreas. Okay, if you see here, they have removed the transverse mesocolon. Okay, so they have removed the transverse mesocolon. So this attachment what you see here, okay, this attachment what you see here is the transverse mesocolon. They have removed the transverse mesocolon to show you the pancreas completely. Okay, I think it is clear. So if you remove the transverse mesocolon here, you can see the pancreas, and the pancreas is related, the head of the pancreas, if you see, okay, it is related to the duodenum. Okay, it is related to the duodenum. So you can see the duodenum here. So the relationship of the pancreas, okay, the relationship of the pancreas, okay, it is related to the duodenum. The head is related to the duodenum. Okay, head is related to the duodenum. Okay, the head on the posterior aspect, okay, it is related to the bile duct. The head on the posterior side is related to the bile duct. Okay, it is also, if you see here, it is also related to this vein. This vein is called as inferior vena cava, which lies behind the head of the pancreas. So the head of the pancreas posteriorly, it is also related to inferior vena cava. Okay, so on the right side of the head you have the duodenum. Okay, and to the posterior side of the head you have the bile duct and the inferior vena cava, and the bile duct enters the pancreas from its posterior surface. The bile duct enters the pancreas from its posterior surface. Okay, it is entering the pancreas and it fuses with the main duct of the pancreas. Yesterday we saw that also. So this is the relationship of the head posteriorly. If you see the neck of the pancreas, okay, so here you can see in the neck there is an elevation which is seen. Okay, so there is an elevation which is seen here in the neck of the pancreas. Okay, so this elevation what you see here is called as tuber omental of the pancreas. So this is called as what? This is called as tuber omental of the pancreas. This is called as tuber omental of the pancreas. Okay, why do you want to say about this tuber omental? Okay, so one important artery, okay guys, yes, one important artery is related to the tuber omental of the pancreas. Okay, so what is that artery? The artery which is seen here, okay, just above the tuber omental, is nothing but the celiac trunk. It is nothing but the celiac trunk. So what is this trunk? This trunk is called as celiac trunk. This trunk is called as what? This trunk is called as celiac trunk. So if you take the neck is related superiorly to, okay, the neck is related superiorly to the celiac trunk. It is related superior to the celiac trunk. Okay, the posterior relationship of the neck is again important. Okay, one important vein is found behind the posterior neck of the pancreas. Okay, the vein which is passed behind or which is formed behind the posterior surface of the neck is nothing but our portal vein. It's nothing but our portal. So portal vein formation, okay, portal vein formation takes place behind the neck of the pancreas. Okay, so if you see the pancreas, okay, so I'll just draw a simple diagram here. So this is pancreas. Okay, so this is the body of the pancreas, tail of the pancreas, and the uncinate process of the pancreas. So there is a vein which runs behind the body of the pancreas. This vein, can anybody tell me what is a vein that runs behind the body of the pancreas, guys? What is a vein that runs behind the body of the pancreas? Yes, anybody? What is a vein that runs behind the body of the pancreas? Very good, Mukundan, very good. It is splenic vein. It is splenic vein. Okay, this is splenic vein, and this splenic vein joins with an vein which runs from below, that is the superior mesenteric vein. So there is a vein which runs from this portion. Okay, so this vein which is running here is the superior mesenteric vein. The superior mesenteric vein and the splenic vein, they join to form the neck, join to form the portal vein. That portal vein formation takes place behind the neck of the pancreas. So what is this vein? So this vein, what you see here, is the superior mesenteric vein. This vein is superior mesenteric vein, and they join to form a vein called as portal vein. So this vein is called as portal vein, and this portal vein formation occurs behind the neck of the pancreas. So neck of the pancreas, this is one important relationship you should never forget. Okay, now coming to the body of the pancreas, if you see the body of the pancreas, okay, so if you see the body of the pancreas, okay, so behind you got a lot of structures which is crossed by the body of the pancreas. Okay, here you can just behind you can see the kidney of the left side. Okay, and you can also see the suprarenal gland which is related to the posterior side. Okay, one important relation to the body of the pancreas is, if you see the body of the pancreas, on its superior border, you see a tortuous artery which is running. On the superior border of the pancreas. Okay, so what is this? The artery which is running on the superior border of the pancreas. Okay, superior border of the pancreas. Okay, superior border of the body. Okay, the artery which is running is the splenic artery. Okay, the artery which is running is the splenic artery. Okay, and on the posterior aspect of the body, okay, you have the left crus of the diaphragm. You have the left crus of the diaphragm. You have the left kidney. Okay, you have the left kidney, and you have also got the left suprarenal gland close to it. And one more important structure runs in the posterior side, that is the splenic vein. So all these structures runs on the posterior surface of the body. Okay, so these are all the important relationship of the pancreas. So what I want you to understand here is, on the anterior side, the entire pancreas gives attachment to this colon. This colon is called as transverse mesocolon, and this transverse mesocolon hold this portion of the large intestine, and the portion of the large intestine which is seen here is nothing but the transverse colon. So if you want to see this relationship, only when you remove the transverse colon, only when you remove the transverse colon. Okay, so if you remove the transverse colon, I'm just removing the transverse colon here. When I remove the transverse colon, I can see all the structures. Okay, I can see all the structures. I can see the duodenum, I can see the pancreas. Okay, so you can see the pancreas. Okay, so when I remove the transverse colon, okay, there is a structure or there is a vessel that comes in between the duodenum and the transverse colon, and that vessel is the superior mesenteric vessels. Okay, and the superior mesenteric vein. So these vessels comes here. Okay, so this is a vessel which is lying in between the duodenum and the transverse colon. So transverse colon is a part of large intestine, duodenum is a part of small intestine. Between these two lies these two vessels, that is the superior mesenteric vessels. They are the superior mesenteric vessels. Okay, so this orientation you should understand. Only when you understand this orientation, you can understand the peritoneal reflections easily. So if you come from anterior, okay, you see the transverse colon, you lift the transverse colon here, you cut the transverse colon, you see the retroperitoneal structures, namely the duodenum and the pancreas, namely the duodenum and the pancreas. Okay, so this is about the relationship of the pancreas. Main is the duct system of the pancreas, very important. Lot of question comes from this duct system. Okay, so tail, I think we have seen about the tail. So tail is nothing but it is a small area at the distal part of the pancreas lying within. It lies in the lineorenal ligament. It lies in the lineorenal ligament. So here it is related to the splenic vessels. Here it is related to the splenic vessels. So here it is related to the splenic vessels, and here it is related to the hilum of the spleen. Here it is related to the hilum of the spleen. So this is all the relationship of the tail of the pancreas. So tail of the pancreas is related to the splenic vessels, and it is also related to the hilum of the spleen. It is also related to the hilum of the spleen. It is also related to the hilum of the spleen. Okay, so if you see the pancreas, okay, so the pancreas is an endocrine cum an exocrine organ. Okay, it is nothing but a combination of, pancreas is nothing but a combination of endocrine plus an exocrine organ. Okay, I hope you know what are the exocrine part called as. Okay, so they are the main ductular systems which secretes the pancreatic enzymes and pancreatic juices. Endocrine part is the islet of Langerhans. Okay, so they are the islet of Langerhans. Okay, so this islet of Langerhans secrete various hormones. Yes, they secrete glucagon, they secrete insulin, they secrete others other related hormones in this area. And exocrine secretes, the exocrine part secretes the pancreatic juice. Exocrine part secretes the pancreatic juice, and this exocrine part secrete the juice into the duct system, whereas the endocrine part secretes their secretion into the blood vessels. Okay, they secrete their secretions into the blood vessels. I think somatostatin is one more hormone which is secreted by the islet of Langerhans. Okay, so I'm not going into the physiology of pancreas. We'll just restrict ourselves to the duct system of the pancreas. See, if you see the pancreas, okay, so you know the parts of the pancreas very well now. So we have discussed about the parts of the pancreas: the tail, body, the head, neck, and the uncinate process. Okay, so there is a duct which runs in the tail and the body of the pancreas. This duct which is running here is called as the main pancreatic duct. This is called as the main pancreatic duct. Okay, this is the main pancreatic duct, guys. This is the main pancreatic duct, and this main pancreatic duct, okay, this main pancreatic duct is also called as, this main pancreatic duct is also called as, it is also called as duct of Rysberg. Okay, it is also called as duct of Rysberg. Okay, it is also called as duct of Rysberg. Okay, so the main pancreatic duct, when it comes, okay, it is draining the tail. Okay, it is draining the tail, it is draining the body, okay, it is draining the neck portion, and it also drains some portion of the head. Okay, and it fuses with another duct coming from above, that is the biliary duct. Okay, so the bile duct. Okay, so both of them fuses and they open into the second part of the duodenum. They open into the second part of the duodenum. Okay, where do they open? So they open into the second part of the duodenum, and this area is called as what? This is called as, yes, it is called as Wirsung. Yes, correct, Anashwara, it is called as Wirsung. It is called as Wirsung, right? It is called as just a small spelling mistake. It is called as duct of Wirsung. Okay, this is called as duct of Wirsung. So this opening of the main pancreatic duct along with the fusion of the bile duct is called as the ampulla of Vater, and they open into the second part of the duodenum, and they open into the second part of the duodenum. They open into a structure called as major duodenal papilla. This is called as major duodenal papilla. This is called as major duodenal papilla. And where is this major duodenal papilla seen? This major duodenal papilla is seen 8 to 10 centimeter. It is seen 8 to 10 centimeter distal to the pylorus. Distal to the pylorus. It is seen 8 to 10 centimeter distal to the pylorus. Okay, so 8 to 10 centimeter distal to the pylorus, you get a major mucosal fold. This major mucosal fold is called as the major duodenal papillae, and this main pancreatic duct drains here. Okay, so the lower part of the head and some portion of the upper part of the head, okay, is drained by an accessory pancreatic duct which runs in front of the main pancreatic duct. Okay, which runs in front of the main pancreatic duct. This accessory pancreatic duct also opens into the second part of the duodenum, but they open into a small papilla. This papilla is called as what? This papilla is called as minor. This is called as minor duodenal papilla. This is called as minor duodenal papilla. This is called as minor duodenal papillae, and this minor duodenal papillae lies at a distance of 6 to 8 centimeter distal to the pylorus. They lies at a distance of 6 to 8 centimeter distal to the pylorus. Okay, so this accessory pancreatic duct. So what is this duct? This is an accessory pancreatic duct. Okay, so this accessory pancreatic duct is also called as, it is also called as duct of Santorini. So this accessory pancreatic duct is also called as duct of Santorini. It is called as duct of Santorini. It is called as duct of Santorini. Okay, so one is called as duct of Wirsung, another one is called as duct of Santorini. So one is the main pancreatic duct, another one is the accessory pancreatic duct. Okay, now you can ask me how this duct system are formed. Okay, so if you want to understand the duct system, we need to understand the development of the pancreas. We'll just discuss that also. So if you see the duct receives the interlobular ducts. Okay, and the interlobular ducts like this. Okay, so they give a classical appearance here. Okay, so this classical appearance of the duct system of the pancreas is called as, yes guys, anybody, what is this pattern called as? What is this pattern called as? I think you would have studied this. What is this pattern called as? This pattern of arrangement of the duct system in the pancreas is called as herringbone pattern. This is called as what? This is called as herringbone pattern. Okay, herringbone pattern. Okay, herringbone pattern is a pattern which you see here. So the pancreatic duct receives their ducts in the herringbone pattern. Okay, so if you see the pancreas, okay, so the pancreas is a part which is developed from the foregut. Okay, so if you take the foregut, okay, let us consider the distal part of the foregut where the second part of the duodenum ends. So this is the foregut. Okay, this is the distal part of the foregut. So let us consider this is the distal part of the foregut. So this is the distal part of the foregut. Okay, so what is happening in the distal part of the foregut? So you see the development of two buds. Okay, one on the ventral aspect, a small bud on the ventral aspect. Okay, and a big bud on the dorsal aspect. Okay, and a big bud on the dorsal aspect. Okay, so there are two buds which are seen around the distal part of the foregut. Okay, so one is the ventral bud. So one is the ventral bud. This is small. Okay, this is small. Okay, and this is slightly caudal. This is slightly caudal in nature. Okay, whereas the bud which is formed on the posterior aspect of the foregut is the dorsal bud. Okay, and it is larger and it is slightly cranial. Okay, so in order to understand the formation of this, I'm just going to make a cross section here. If I make a cross section, I can able to see the duodenum like this. Okay, or the distal part of the foregut like this. The distal part of the foregut forms the second part of the duodenum. Okay, so that is why I'm telling this also as the duodenum. So this forms a second part of the name, a part of the second part of the duodenum. So if you see here, there is a bud which is present here. So this bud is the dorsal bud. So what is this bud? This is the dorsal bud, and the bud which you see here is called as the ventral bud. This is called as the ventral bud, and this is called as the dorsal bud. Now what happens is, in the intestine, okay, an embryological sequence happens which is called as the rotation of the gut. We'll discuss about the rotation of the gut also. Okay, so whenever the rotation of the gut happens, okay, so this ventral bud goes to the right side and the dorsal bud goes to the left side. Okay, so what happens now is, because of the rotation of the gut, okay, so which takes place in an anti-clockwise direction, okay, so the duodenum also rotates, and the ventral pancreatic bud goes to the right side, and the dorsal pancreatic bud, okay, it comes to the, and the dorsal pancreatic bud comes to the left side here. Okay, it comes to the left side here. Okay, now this is the right wall of the duodenum. So what is this wall? This is the right wall of the duodenum. Okay, this is the right wall of the duodenum. This right wall of the duodenum grows more than the left wall. It grows fast. Because of this growth, the ventral bud is carried to the left side. So it is because of the differential growth of the wall of the duodenum. The ventral bud goes to the left side. Okay, if you see the next picture, I'll draw it here. So the duodenum is here, the dorsal bud is here, okay, and the ventral bud comes below and fuses with the dorsal bud. So when you see the proper orientation, you can see this diagram so that you can easily understand this. So this is the second part of the duodenum. So you can see the dorsal bud, okay, which is here, and the ventral bud, since it is slightly caudal, it comes and fuses with the dorsal bud here. So this is the dorsal bud and this is the ventral bud. So this is how the pancreas is formed. Okay, so since you have the dorsal bud above, so this dorsal bud forms. Okay, this dorsal bud gives rise to the upper half of the head. It gives rise to the neck of the pancreas. It gives rise to the body of the pancreas, and it gives rise to the tail of the pancreas. Whereas the ventral bud gives rise to the lower part of the head, lower half of the head, and it also gives rise to the uncinate process, okay, so this is how the pancreas is derived. Okay, so we have got two buds for the pancreas. One is a dorsal bud, another one is a ventral bud. How the dorsal bud and the ventral bud comes close together? It is one due to the rotation of the gut. Okay, next it is due to the differential growth of the right wall of the duodenum. Okay, so guys, please remember this. Okay, so this dorsal bud, okay, and this ventral bud, okay, they have got their own duct system. Okay, so they have got their own duct system. Okay, so initially what happens is, the main pancreatic duct, the main pancreatic duct opened into the minor duodenal papillae like this, and the accessory pancreatic duct, okay, so it was opening into the major duodenal papillae like this. But what happens is, during the course of the development, okay, the duct of the dorsal bud, okay, so the duct of the dorsal bud, okay, fuses with the duct of the ventral bud, and they opened into this papilla, which becomes a major duodenal papillae. Okay, so initially the dorsal bud was opening above and the ventral bud was opening below, but in the due course of development, the duct of the dorsal part fuses with the duct of the ventral bud, and they form the main pancreatic duct, and the part which is left here, okay, Okay, so the part which is left here becomes the accessory pancreatic duct. So this becomes the okay, this becomes the main pancreatic duct. This becomes the main pancreatic duct. This becomes the main pancreatic duct, and this becomes the accessory pancreatic duct. This becomes the accessory pancreatic duct. This becomes the accessory pancreatic duct. Okay, fine. So I think you understood what is the development of pancreas. So it develops from the ventral bud and the dorsal bud. Okay, so yesterday when we were discussing about this duct system, we also saw one important thing related to the duct. Okay, at the ends of the ducts, so you got sphincters to control the secretions. So the sphincters which are present in the end of the pancreatic duct, the sphincters which are present in the end of the pancreatic duct is the sphincter pancreaticus. So this is called as what? This is called as sphincter pancreaticus. This is called as what? This is sphincter pancreaticus. Okay, this is called as sphincter pancreaticus. And the sphincter, what you see in the distal part of the, okay, what you see in the distal part of the bile duct. Yes, anybody guys, what is the sphincter which is seen on the distal part of the bile duct called as? Yesterday we saw about the sphincter. The sphincter which is present on the distal part of the bile duct is called as, yes, what is that guys? What is that called as? That is called a sphincter choledochus. Very good, that is called a sphincter choledochus. Okay, so this is called a sphincter choledochus. This is called a sphincter choledochus. Okay, this is called a sphincter choledochus. And after the fusion of the pancreatic duct with the bile duct, where they dilate and form the ampulla of Vater, you get a important sphincter here. This sphincter is called a sphincter of Oddi. Okay, this is called a sphincter of Oddi. Yesterday we saw this also. This is called a sphincter. This is called a sphincter of Oddi. And this entire complex, all these three together is called a sphincter of Oddi complex. All these three together called a sphincter of Oddi complex. Now if somebody asks you, you got three sphincters here, which is the strongest among these three? Okay, which sphincter is the strongest sphincter among these three? The strongest sphincter among these three is sphincter choledochus. So what is this? Sphincter choledochus is the strongest sphincter among these three sphincters. Strongest sphincter among these three sphincters. Okay, so herringbone pattern is important. The duct system is important. Duct of Rising and duct of Santorini is important. Where they open is also important. Where they open is also important. Okay, where they open is also important. So if you want to study the duct system, okay, if you want to study the duct system of the pancreas and the duct system of the biliary region, so you can do certain radiological investigations like MRCP. Okay, you can do certain radiological investigations like MRCP or ERCP. Okay, so they will discuss all these things in the radiology session. So one is called as magnetic resonance cholangiopancreatography. Another one is called as endoscopic retrograde cholangiopancreatography. So you can do these studies to study the duct system of the pancreas and the biliary system of this. ERCP, it can also be used for interventional purpose. It can also be used for interventional purpose. Okay, it can be also used for interventional purpose. Okay, so you can dilate the ducts, you can keep the stent in the ducts through ERCP. Okay, so these are the certain radiological investigation to look into this. Okay, so when they do such radiological investigations, okay, when they do such radiological investigations, if you get a double duct sign, okay, if you get a double duct sign, okay, if you get a double duct sign, you can see a double duct sign here. There are two ducts which are dilated here. Okay, so one duct that is dilated is the pancreatic duct, the other duct which is dilated is the bile duct. When these ducts become prominent, why do they become prominent? When their outflow gets obstructed. See, for example, when there is an obstruction in this area, okay, so these ducts can get dilated. Okay, so that dilation happens whenever there is an carcinoma in the head of the pancreas or whenever there is an periampullary carcinoma. Okay, so whenever there is an carcinoma close to the junction of the pancreatic duct and the bile duct, okay, so their outflow get obstructed. Okay, when the outflow get obstructed, the bile cannot come into the duodenum and the pancreatic juice cannot come into the duodenum. And when you do an MRI, okay, when you do an MRI, you can see the ducts getting dilated. Okay, this is in contrast MRI showing the ducts. Okay, So when the ducts are dilated like this is called as double duct sign. This is called as double duct sign. Okay, and moreover, remember there is one important triangle here. Okay, though this triangle which is seen here is called as the gastrinoma triangle. Okay, this is called as gastrinoma triangle. This is called as gastrinoma triangle. Okay, what is this gastrinoma triangle? Okay, what are the boundaries of the gastrinoma triangle? So if you take 3 points here, one point is at the junction of the cystic duct and the common bile duct. So this is one point where the cystic duct meets the common hepatic duct. So this is one point. The next point is at the junction of the neck and the body of the scapula. Okay, neck and body of the scapula. The next point is the junction of the second and third part of the duodenum. If you connect these 3 points, you get a triangle. This triangle is called as what? This triangle is called as gastrinoma triangle because there is a tumor which can arise in the gastrointestinal system. It is called as gastrinoma. That is very common in this region. Okay, and gastrinoma triangle, okay, is drawn with these 3 landmarks. And this gastrinoma is a tumor which is seen commonly in a syndrome called as Zollinger-Ellison syndrome. So there is a syndrome called as Zollinger-Ellison syndrome. Okay, there is a syndrome called as Zollinger-Ellison syndrome. So in Zollinger-Ellison syndrome, you get lot of gastrinomas, and the gastrinomas are commonly seen within this triangle, and this triangle is called as what? This is called as gastrinoma triangle. Okay, how do you draw the gastrinoma triangle? One point is at the junction of the cystic duct with the common hepatic duct. The other is at the junction of the neck and the body of the pancreas. Other at the junction of the second and third part of the duodenum. Okay, so this triangle is called as gastrinoma triangle. Okay, so these are certain applied aspects related to pancreas. One very important applied aspect related to the embryology of the pancreas. See, normally what happens is the pancreas has to rotate and it has to fuse. The ventral bud and the dorsal bud has to fuse with one another. If they don't fuse with one another, okay, if suppose they don't fuse with one another, so let us consider this is the duodenum. Okay, so this is the duodenum and you have the dorsal bud here. Okay, so you have the ventral bud here and you got the dorsal bud here. They haven't fused with one another. Then it is called as pancreatic divisum. This condition is called as pancreatic divisum. Okay, so what is this condition? This condition is called as pancreatic divisum. This is called as pancreatic divisum. Okay, this is called as pancreatic divisum. Okay, so sometimes what happens is the pancreatic tissue might completely engulf the entire duodenum. Okay, sometimes the pancreatic tissue, okay, might completely engulf the pancreas. Okay, so let us consider this is duodenum. Okay, sometimes the pancreatic tissue, what it does is it completely engulfs the pancreas. So whenever the pancreatic tissue is completely engulfing the duodenum, we call this condition as anybody tell me when the entire yes, very good Mukundan. Yes, it is annular pancreas. It is called as annular pancreas. Now if there is an annular pancreas, okay, okay, what part of the duodenum is going in for obstruction? Can anybody tell me what is the part of the duodenum that is going in for obstruction in annular pancreas, guys? Anybody? What is the portion of the duodenum that goes in for obstruction? Yes, it is the second part of the duodenum that goes in for obstruction. So when there is a second part of duodenal obstruction, okay, you take the patient to X-ray and you take the abdominal X-ray. Okay, when you take the abdominal X-ray, what sign you will get, guys? You take a plain X-ray of the abdomen without any contrast. There is an obstruction in the second part of the duodenum. Maybe it is due to annular pancreas or maybe it is due to constriction. You get a sign called as double bubble sign. Very good, guys. It is called as double bubble sign. So you get a sign called as double bubble sign. So this is called as an double bubble sign. Okay, so there are a lot of bubble signs, so we will discuss about that in further classes. So whenever there is an second part of duodenum occlusion happens, okay. So the pylorus and the stomach, okay, and the stomach and the first part of the duodenum, okay, the stomach and the first part of the duodenum dilates and they form a sign called as double bubble sign. They form a sign called as double bubble sign, okay. So this is about the developmental anomalies of the pancreas. So pancreatic divisum is one, annular pancreas is one. There can be malformation in the duct system of the pancreas also. There can be malformation in the duct system of the pancreas also, okay. So these are all certain things which are related to the pancreas, okay. I hope you are clear with pancreas, okay. So we have run down through a lot of things related to pancreas, okay. So with this we'll move to the next topic, okay. So the next topic is the spleen, okay, is the spleen, okay. See, spleen is one happy organ, okay. So spleen is one happy organ. It moves here and there within the abdomen, okay. So it moves here and there within the abdomen. So whenever an organ is moving within the abdomen freely, okay, it must be an intraperitoneal organ, okay. It must be an so spleen is an intraperitoneal organ, okay. It is an intraperitoneal organ, okay. Spleen is an intraperitoneal organ, guys, okay. So spleen, where it is located, it is occupying the left hypochondriac region. It occupies the left hypochondriac region. It occupies the left hypochondriac region, okay. It occupies the left hypochondriac region, okay. If you take the anatomy of the spleen, okay, the spleen has got the odd numbers for it, okay. The odd numbers are very, very favorite for the spleen. So the odd numbers 1, 3, 5, 7, okay, 1, 3, 5, 7, okay, and 9 and 11 are the interesting odd numbers which are related to the spleen. I think this they would have told you in the undergraduate in the first year itself. So spleen is 1 inch thick. It is 1 inch thick. The breadth of the spleen is 3 inches. This is the breadth of the spleen, okay. This is the breadth of the spleen, and the spleen is 5 inches in long. It is 5 inches long, and it is 7 ounces in weight. It is 7 ounces in weight, and it lies between the 9th to 11th rib, and it lies between the 9th to 11th rib, okay. It lies between the 9th to 11th rib, and it lies along the okay, and it lies along the axis of 10th rib. It lies along the axis of the 10th rib, okay. So along the 10th rib lies the axis of the spleen. Along the 10th rib lies the axis of the spleen, okay. If you take the spleen has got two surfaces, okay. Spleen has got two surfaces. So the two surfaces are, one is the diaphragmatic surface, another one is called as a visceral surface, So you got two surfaces for the spleen. One is called as a diaphragmatic surface, another one is called as a visceral surface. So what you see here, this surface is visceral surface, okay. What you see here, this surface is visceral surface. On the other side, what you see, okay, on the side which is not seen here, okay, so that is called as a diaphragmatic surface. That is called as what? That is called as a diaphragmatic surface. Okay. And if you see the spleen has got three borders in it, okay. So it has got three borders in it. So if you draw the spleen like this, okay, so the spleen has got three borders in it. This border, what you see here, is called as a superior border. This border, what you see here, is called as a superior border, and this superior border is usually notched like this. It is usually notched like this. So you can see the notches in the superior border. This is very, very important finding for a spleen. When you clinically palpate the spleen, it is because of this notches you can able to confirm that is spleen. So spleen notches are usually seen in the superior border, okay. And there is a border which is seen here. This border is called as the inferior border, okay. So this border is called as an inferior border. This border is called as an inferior border. In between these two border runs this border. What is this border? This border is called as an intermediate border, okay. So there is a border here which is called as an intermediate border. This is called as an intermediate border, and this intermediate border divides into two, okay, and this forms the anterior end of the spleen. This is called as the anterior end of the spleen, okay. and the posterior end of the spleen is here and the posterior end is here. Okay, so the anterior end is broad. Okay, the anterior end is broad and it is related to a ligament. Okay, the anterior end of the spleen is related to a ligament called as phrenicocholic ligament. It is related to phrenicocholic ligament. It is related to phrenicocholic ligament. Okay, it is related to phrenicocholic ligament. Okay, so this is about okay, this is about the basic anatomy of spleen. So this is called as phrenicocholic ligament. This is called as phrenicocholic ligament. Okay, so when you take the surfaces, so there are two surfaces. One is called as the diaphragmatic surface, another one is called as the visceral surface. Okay, so lot of things happens on the visceral surface. Let us see one by one. So if you see the intermediate border first, okay, if you see the intermediate border, this intermediate border gives attachment for two peritoneal folds. Okay, and it is in this region you get the hilum of the spleen also. Okay, so it is in this region you get the hilum of the spleen. So what is present here is the hilum of the spleen. Okay, so hilum of the spleen is situated in the intermediate border. It is situated in the intermediate border. Hilum of spleen is situated in the intermediate border. Okay, so this spleen gives attachment to two ligaments along the intermediate border. One ligament which is seen here. Okay, one ligament which is seen here coming from the kidney is called as the lienorenal ligament. So what is this? So this is called as the lienorenal ligament. This is called as lienorenal ligament, and other ligament which is seen here is called as the gastrophrenic ligament. So this is called as gastrosplenic ligament. This is called as gastrosplenic ligament. So this ligament is called as gastrosplenic ligament. So you got lienorenal ligament and gastrosplenic ligament. So if you want to add here, so you can add like this. These are all the ligaments of the spleen. These are all the ligaments of spleen. Okay, so this ligament of spleen is one is called as gastrosplenic ligament. One is called as gastrosplenic ligament. Okay, the next ligament what you see here is the lienorenal ligament. Is called as a lienorenal ligament. Okay, these two ligaments are connected to the spleen, but there is a ligament which is not connected to the spleen, but it still supports the spleen. What is the function of all these ligaments? They support the structures, and they will also allow the blood vessels to reach the structure. Okay, so there is one ligament which is not related or which is not attached to the spleen, but it's still supporting the spleen. So that ligament is called as phrenicocholic ligament. That is called as phrenicocholic ligament. So these are all the ligaments of the spleen. These are all the ligaments of the spleen. Okay, if I want to put a simple diagram here to understand this, so this will be the posterior abdominal wall. So this is the posterior abdominal wall. I hope you know in the posterior abdominal wall you get the kidneys here. You get the kidneys here. Okay, so you get the kidneys here. So this is the left kidney. Let us consider this is the left kidney. Okay, in front of the left kidney, okay, in front of the left kidney you have the spleen. Okay, in front of the left kidney you have the spleen here. So they have the spleen. Okay, so in front of the kidney you also have the structure called as stomach. So this is called as the stomach. Okay, so this is called as stomach. Now the peritoneum or the peritoneal fold, okay, which extends, okay, the peritoneal fold which extends from the kidney to the spleen. Okay, the peritoneal fold which is extending from the kidney to the spleen is called as the lienorenal ligament. Okay, so this encloses the spleen and it gets reflected to the stomach, to the greater curvature of the stomach. So this ligament is called as the lienorenal ligament. So what is this ligament? So the ligament what you see between the kidney and the spleen is called as the lienorenal ligament. This is called as lienorenal ligament, and the portion of the ligament which is running between the spleen and the stomach is called as gastrosplenic ligament. It is called as gastrosplenic ligament. It is called as gastrosplenic ligament. It is called as gastrosplenic ligament. And there is one important artery which runs through the lienorenal ligament. Okay, that arises from the celiac trunk. Okay, and it is tortuous in nature and it runs in the lienorenal ligament and it supplies the spleen. Okay, so the artery which is tortuous and it is running in the lienorenal ligament is nothing but the splenic artery. So what is this artery? So the artery which is running here is called as a splenic artery. This is called as splenic artery, Okay, so from the splenic artery, there are certain branches which runs through the gastrosplenic ligament. From the splenic artery, branches runs through the gastrosplenic ligament and supplies the stomach. And the question is here, can anybody tell me what is these branches which are running through the gastrosplenic ligament and supplying the stomach? Okay, so there are certain vessels from the splenic artery running through the gastrosplenic ligament and supplies the stomach. Very good, Anashwara, very good. It is short gastric arteries. These are called as short gastric arteries. Okay, these are called as short gastric arteries. These are called as short gastric arteries. These are called as short gastric arteries. Okay, these are called as short gastric arteries. Very good. So these are all the two important ligaments which are related to the spleen. And the next ligament which you see here, extending from the diaphragm to the splenic flexure of the colon. So this ligament which you see here, okay, so phrenicocholic ligament, phrenicocholic ligament extends between, okay, it extends between the splenic flexure of the colon. It extends between the splenic flexure of the colon and the diaphragm. It extends between the splenic flexure of the colon and the diaphragm. Okay, so this supports the anterior end of the spleen. Okay, this supports the anterior end of the spleen is the one which is shown here. So this ligament is called as a phrenicocholic ligament. Okay, this ligament is called as a phrenicocholic ligament. Now if you take the abdominal wall on the lateral side, okay, you have a colon close to it. This colon is called as the descending colon. So this is the transverse colon which is becoming the descending colon, okay, and there is a gutter which is seen between the descending colon and the lateral abdominal wall. Okay, so there is a gutter which is seen between the descending colon and the lateral abdominal wall. This is called as the left paracolic gutter. This is called as what? This is called as the left paracolic gutter. So this is called as left paracolic gutter. Okay, this is called as left paracolic gutter, guys. Okay, so normally when the spleen enlarges, the spleen has to enlarge into the left paracolic gutter. Okay, so when the spleen tries to enlarge into the left paracolic gutter, there is a ligament which is preventing the entry of the spleen into the left paracolic gutter, and that is nothing but the phrenicocholic ligament. Okay, that is why this ligament is also called as sustentaculum lenis. It is called as sustentaculum lenis. Phrenicocholic ligament is also called as sustentaculum lenis. Okay, this prevents the enlargement of spleen into the left paracolic gutter. This is an important MCQ which were asked in the previous years. So left paracolic gutter, okay, so the spleen has to enlarge into that area. There are a lot of conditions which can cause splenomegaly. One common condition is malaria, which can cause splenomegaly. So when the spleen tries to enlarge, it is not entering the left paracolic gutter because of this ligament. Now in which direction the spleen will enlarge, towards which fossa the spleen will enlarge? What is the fossa, in which fossa direction the spleen will enlarge now? Anybody? Yes, when the spleen enlarge, yes, very good, it enlarges towards the right inguinal fossa. Okay, it enlarges towards the right inguinal fossa, correct? Yes, very good, Mukundan. So whenever you palpate the spleen, okay, you have to start from the right inguinal fossa, cross the midline towards the umbilical region, and you try to reach the left hypochondriac region. So whenever you try to palpate the spleen, okay, so if you take the abdomen here, this is the umbilicus, the spleen tries to enlarge in this direction. So whenever you palpate in a reverse direction from the, this is the right side, and the left side, the spleen is here, and if it enlarges, it is enlarging towards the right inguinal fossa. So you start palpating from the right inguinal fossa across the umbilicus. You try to go towards the left hypochondriac region. You ask the patient to breathe in and out, so the spleen will move. When the spleen moves, it is the anterior and the superior border that comes into contact. When the anterior and superior border comes into contact, there is one classical feature of the superior border we have seen, so that is called as the notching. Okay, so you can see the notches and you can feel the notches by palpation. You can feel the notches, thereby you can identify that the spleen is enlarging there. Okay, so these are all important ligaments related to the spleen. Next is the structures, visceral structures that are related to the spleen. So if you take the spleen, okay, so this area, okay, so this area what you see here, okay, is related to the stomach. Okay, so we'll just draw this or you can just mark it here. Yes, okay, so what is this area? This area is related to the stomach. Okay, this area is related to the stomach. This area is related to the kidney. This is related to the kidney. Okay, this area is related to the splenic flexure of the colon. This is related to the splenic flexure of the colon. This is related to the splenic flexure of the colon. Okay, and towards the hilum, it is related to the tail of the pancreas. It is related to the tail of the pancreas. Okay, so at the hilum, it is related to the tail of pancreas. So these are all the visceral relationship. For the spleen. Okay, the spleen is related to stomach, kidney, splenic flexure of the colon, and to the tail of the pancreas. Okay, so on the lateral side, it is related to the pleura. Okay, it is related to the pleura. Okay, so there is a recess there. Okay, that recess is called as the costodiaphragmatic recess. So what you see here is the costodiaphragmatic recess, guys. Okay, so this recess is called as costodiaphragmatic recess, which is related to the spleen. Okay, outside the diaphragm. So this is called as costodiaphragmatic recess. This is called as what? This is called as costodiaphragmatic recess. So these are all the important things which are related to spleen. Now what is the blood supply of the spleen? Yes, we know that the spleen is supplied mainly by the splenic arteries. It is supplied by the splenic artery, and the splenic arteries are usually end arteries. Okay, they are usually end arteries. Okay, so the vein which is draining the spleen is nothing but the splenic vein. Okay, so the splenic vein is the one which drains the spleen, and I hope you know splenic artery is a branch of, or it is a direct branch of celiac trunk. Yes, it is a direct branch of celiac trunk. And splenic vein is a tributary of portal vein. So these are all the important blood vessels of the spleen. Okay, splenic artery and the splenic vein, their source of origin. Okay, so if you take the spleen, where does the spleen arises from? Okay, so if you want to understand that, I'll again draw you a simple schematic diagram. So this is the development of spleen. Okay, so this is the development of the spleen. Okay, so where does the spleen develops? If you take a cross section of the primitive abdomen, okay, so there is an primitive stomach which was developing, or a primitive foregut which was developing here. This primitive foregut was connected to the anterior abdominal wall and the posterior abdominal wall by means of a peritoneal fold which is called as mesogastrium. Okay, so if you see here, so you can see the peritoneal fold extending from the anterior abdominal wall to the stomach, or the primitive stomach, which is called as ventral mesogastrium. So what is this? This is called as ventral mesogastrium. Okay, so on the posterior part of the abdomen, you can see the kidney which is developing here. And the peritoneum extends from the post-abdominal wall. Okay, the peritoneum extends from the post-abdominal wall to the primitive stomach. So this extension which is seen from the post-abdominal wall, so this is the post-abdominal wall. So this mesogastrium will be the dorsal mesogastrium. This is called as what? This is called as dorsal mesogastrium. Okay, this is called as dorsal mesogastrium. Okay, this is called as dorsal mesogastrium. So what happens is slowly, okay, in the left leaflet of the dorsal mesogastrium. Okay, so this is right side. Let us mark this. This is right side and this is left side. Okay, so if you see if you take the primitive gut, okay, so if you take the primitive gut, so you have the ventral mesogastrium here, okay, and okay, and you got the dorsal mesogastrium here, okay, you got the dorsal mesogastrium here. So on the left side of the dorsal mesogastrium, or on the left leaflet of the dorsal mesogastrium, okay, collection of mesoderm happens, okay, collection of mesoderm happens, and the collection of mesoderm in this area, okay, in this area forms the spleen, okay, it forms the spleen. So if somebody asks you, spleen develops from where? It develops from the dorsal mesogastrium. If you want to specifically say in which leaf of the dorsal mesogastrium, it arises from the left leaf of the dorsal mesogastrium, it arises from the left leaf of the dorsal mesogastrium. So you can very well see here kidney is present here, okay. So the portion of the dorsal mesogastrium, extending between the kidney or from the posterior abdominal wall to the spleen is called as lienorenal ligament. So this portion becomes the lienorenal ligament. So this is called as a lienorenal ligament. And the portion of the dorsal mesogastrium between the spleen and the stomach, okay, so this portion becomes the gastrosplenic ligament. So this becomes the gastrosplenic ligament. Guys, this becomes the gastrosplenic ligament. Simultaneously, when the spleen is forming on the left leaf of the mesogastrium, dorsal mesogastrium, there is an organ which develops on the right leaf of the ventral mesogastrium. There is an organ which developed in the right leaf of the ventral mesogastrium. Let us consider this is the right leaf of the ventral mesogastrium, and there is an interesting organ which develops in this, okay. Can anybody tell me what is the organ that develops in the right leaf of the ventral mesogastrium called as? Yes, very good Anashwara, it is the liver, okay, it is the liver. So what is this? So this is liver, okay, so this is liver. Now the portion of the ventral mesogastrium, extending between the liver and the stomach, okay, forms the lesser omentum. So this forms the lesser omentum, and the portion of the ventral mesogastrium extending between the liver and the anterior abdominal wall. So this is the anterior abdominal wall. So the portion of the liver, okay, the portion of the ventral mesogastrium extending between the liver and the anterior abdominal wall becomes the falciform ligament, okay. So this becomes the falciform ligament, okay. So this becomes the falciform ligament, and they also forms the coronary ligaments. They also form the triangular ligaments of the liver. So that portion of the ventral mesogastrium between the liver and the anterior abdominal wall gives rise to falciform ligament, gives rise to coronary ligament, gives rise to the triangular ligament, okay. Anyway, we'll see these ligaments once again when we come to the peritoneal reflections. So as of now, if somebody asks you where the spleen develops, you can very well say it develops in the dorsal mesogastrium on the left side. And if somebody asks you where does the liver develops, you can easily say that it develops on the ventral mesogastrium on the right leaflet, okay. So this is about the development of the spleen, okay. And you all know that okay, whenever there is a splenic rupture, whenever there is an injury to the lower ribs, okay, spleen is one organ which can easily get ruptured, and it can cause lot of bleeding inside the abdomen, okay. So they do a routine procedure whenever there is a splenic rupture, okay. They do a procedure called as splenectomy, okay. So this is about the spleen, guys. This is about the development and the location of the spleen, okay. So with this background, okay, we'll slowly move to the next topic in the workbook, okay. So yes, they were discussing about the stomach and their blood supply, I think so. Yes, stomach and the blood supply, we'll just start that, okay. So before going into that, so we'll just see what is given in this diagram, okay. So this diagram is a diagram showing the important structure of the post abdominal wall. So one important structure which is seen in the posterior abdominal wall is the abdominal aorta, okay. So what is this? So this is abdominal aorta, okay. So this is abdominal aorta, okay. Abdominal aorta is a continuation of the descending thoracic aorta, okay. And how it enters the abdomen? It enters the abdomen through an opening in the diaphragm, which is called as aortic opening. I hope you know there are three major openings in the diaphragm, okay. So diaphragm has got, okay, so diaphragm has got three major openings, guys, okay. So the major openings which are seen in the diaphragm are, okay, there are three major openings, okay. One major opening is for the IVC, okay, it is called as an vena cava opening. Then next opening is for esophagus, it is called as an esophageal opening, okay. The next opening is for the aorta, it is called as an aortic opening, okay. So they transmit the corresponding structures, okay. So through the IVC runs the IVC, through the esophagus runs the esophagus and the vagus nerves, and through the aortic opening runs the aorta and the azygos vein, okay. Azygos veins and the thoracic duct runs along with the aortic opening. So in the aortic opening, along with aorta, guys, yes, along with aorta, you will also have the azygos vein which is running, okay, azygos vein which is running in this, and you will also have the thoracic duct which is running in this, running through this opening, okay. Now if can anybody tell me what is the level in these openings are seen in the diaphragm, okay. What are the levels in which these openings are seen? IVC opening is seen at the level of, yes guys, where does the IVC opening is seen? I hope you guys would have studied all these things, you are thorough in this, okay. Yes, very good, Anashwara. Yes, aortic opening, IVC opening is seen at the level of T8, okay, and esophageal opening is seen at the level of T10, okay. Esophageal opening also seen at the level of T10, and aortic opening is seen at the level of T12. Aortic opening is seen at the level of T12. So what you see here is the aortic opening, and okay, this aortic opening is situated at the level of T12 vertebra, and through the aortic opening you have the aorta. When the aorta enters the abdomen, okay, it gives lot of branches, here, it gives lot of branches. So if I want to classify the branches of the aorta, abdominal aorta, okay, so aorta, there are three set of branches. One branches which are arises from the ventral aspect, they are called as ventral branches. The branches which are arising from the lateral aspect, they are called as the lateral branches, and the branches which are arising from the posterior side, they are called as the dorsal branches, okay. So what are all the ventral branches, guys? So from the ventral, okay, you get three branches from the aorta. So these are the ventral branches of the aorta. So aorta ventral branches are three mainly. One is called as the celiac trunk. This celiac trunk arises at the level of T12L1 junction, okay, T12L1 junction, it arises at the level of T12L1 junction. And the next ventral branch is the superior mesenteric artery. Next branch is called as the superior mesenteric artery, which arises at the level of L1. The next artery which is seen here is the inferior mesenteric artery, So this is the inferior mesenteric artery which is seen at the level of L3, guys, okay. So when you take the aorta, the ventral branches are three, okay. One is called as the celiac trunk, and the next one is called as the superior, okay, mesenteric artery. The last one is called as the inferior mesenteric artery. They are shown in the images here, okay. And what are all the lateral branches? Okay, the first lateral branch what you see here is the inferior phrenic artery. Inferior phrenic artery is a branch which arises from the lateral side. Inferior phrenic artery supplies the diaphragm, okay, and this inferior phrenic artery also gives a branch to the suprarenal gland, which is called as the superior suprarenal artery. This is called as superior suprarenal. So from the inferior phrenic artery, there is an artery which supplies the suprarenal gland, that is called as superior suprarenal artery, okay, that is called a superior suprarenal artery, okay guys, that is called a superior suprarenal artery. And from the lateral side, the next branch is the middle suprarenal artery, okay. Middle suprarenal artery is here. The next lateral branch is the renal artery. The renal artery gives the inferior suprarenal artery. So okay, so the renal artery gives a branch here, so that is called as inferior suprarenal artery. Okay, it is called as inferior suprarenal artery. Okay, so suprarenal gland, though it is a small gland sitting silently over the kidney. Okay, it has got 3 vessels supplying it. One is superior suprarenal artery, which is a branch of inferior phrenic artery. Middle suprarenal artery, direct branch of aorta. Inferior suprarenal artery, which is a branch of the renal artery, Okay, so the next branch is the renal artery, which arises at the level of L2. Okay, the next branch is the gonadal artery, which is seen here. Okay, the gonadal artery, which is seen here. So these are all the lateral branches. Okay, so what are all the lateral branches, guys? Yes, the lateral branches are, one is inferior phrenic artery, one is inferior phrenic artery, one is called as inferior phrenic artery. The next branch is the middle suprarenal artery, next branch is called as middle suprarenal artery. And the next branch which is arising here is the renal artery, and the next branch which is seen on the lateral side is the gonadal arteries, Okay, it is the gonadal arteries. Okay, fine. So this is the gonadal arteries. And what are all the dorsal branches? The dorsal branches are 4 lumbar branches, lumbar arteries, and 1 median sacral artery. So you can see the first lumbar, second lumbar, third lumbar, and the fourth lumbar arteries, and the median sacral arteries arising from the dorsal aspect of the abdominal aorta. So these are all the branches of the abdominal aorta, and abdominal aorta finally at the junction of L4 and L5 vertebra divides into 2 common iliac arteries, Okay, so at the level of L4, L5 it divides into 2 common iliac arteries. Okay, so with this background we'll go to the next viscera, that is the stomach. Okay, Okay, stomach is one important organ which is related to lot of pathologies like ulcers, cancers. So they will discuss in detail about stomach in the surgical sessions. So just to brush it up. Okay, so we'll see what is happening in the stomach. Okay, so if you see the stomach, stomach is an organ, okay, which is present or which is occupying. So stomach occupies mainly the epigastric region. It also extends into the left hypochondriac region. It is also extending into the left hypochondriac region, and it also is seen in the umbilical region. Okay, these are all the regions seen in the abdomen, or the quadrants of the abdomen. So stomach occupies the epigastric, left hypochondriac, and the umbilical quadrants of the abdomen. Okay, if you see the stomach is a continuation of the abdominal part of the esophagus. So the abdominal part of the esophagus, after passing through the diaphragm, continues as the stomach. Okay, so this stomach is a J-shaped structure which continues as the duodenum, Okay, and if you see the stomach has got the following parts. It has got the fundus, it has got the body. Okay, it has got the body, and it has got the pylorus. Okay, so this part is called as the pylorus. So this is called as pylorus. This pylorus has got 2 parts in it. So this is called as pylorus. Okay, this pylorus has got 2 parts in it. Okay, so this part is called as the pyloric antrum. This is called as pyloric antrum. And this part is called as the pyloric canal. This is called as the pyloric canal. Okay, this is called as pyloric canal. Now there are 2 important curvatures for the stomach. See, always stomach, the number 2 is very lucky for the stomach. Okay, so one is the curvature. There are 2 curvatures for the stomach. One is called as the lesser curvature of the stomach. So this is called as the lesser curvature of the stomach. And this is called as the greater curvature of the stomach. So you have got 2 curvatures. One is called as the lesser curvature, and another is called as a greater curvature. If you see the lesser curvature runs and forms an angle here. This angle, what you see here, is called as the incisura angularis. So this angle, what you see here, is called as the incisura angularis. This is called as incisura angularis. This is called as the incisura angularis. If you draw an imaginary line from the incisura angularis to the greater curvature, you divide the body and the pyloric antrum by this imaginary line. So this imaginary line running from the incisura angularis to the greater curvature of the stomach divides the body of the stomach from the pyloric antrum. Okay, similarly you got another incisura or another notch here. This notch what you see here is called as a cardiac notch of the stomach. This is called as a cardiac notch of the stomach. Okay, and if you draw an imaginary line from the cardiac notch to the greater curvature of the stomach, whatever portion you get above is called as the fundus of the stomach. Whatever portion you get above is called as the fundus of the stomach. Okay, so you divide the stomach into fundus body and the pyloric region based on this imaginary line coming from the cardiac notch and coming from the incisura angularis. Okay, and if you take the stomach has got two surfaces, as I told you. Then number 2 is lucky, it has got an anterior surface or an anterior superior surface, and then posterior or an posterior inferior surface. Okay, posterior and posterior inferior surface. Okay, so these are all certain things which are grossly related to the stomach. Okay, so if you want to study the coverings of the stomach or the peritoneal folds of the stomach, okay, I think I'll open a different page so that I can able to draw things clearly here. Okay, so if you take stomach, so I hope there is a big organ which is present here. So this is called as the liver. Okay, this is called as the liver. Okay, this is called as liver, and stomach is present just below the liver. Okay, stomach is present just below the liver. Okay, so the part of the stomach which is seen here is called as the lesser curvature of the stomach. This is called as the lesser curvature of the stomach, and the part of the peritoneal fold which is extending from the liver to the stomach is called as the lesser omentum. So this is called as lesser omentum. Okay, so this is called as the lesser omentum, and this lesser omentum, okay, though it is attached to the lesser curvature of the stomach, when it reaches the spleen, it is attached to one narrow area. Okay, it is attached to a spleen, it is attached to the liver at one narrow area. Okay, so this narrow area where it is attached is the porta hepatis, and the fissure what you see above is called as the what you see here is called as the fissure for ligamentum. Okay, it is called as the fissure for ligamentum venosum. Okay, so what you see here is the porta hepatis, so it is where it is attached. So the lesser omentum is attached along the porta hepatis. So this is called as the porta hepatis. So where the lesser omentum is attached, and yesterday we discussed that the lesser omentum has got two parts in it. Okay, one part which is related to the duodenum, first part of the duodenum is called as a hepatoduodenal part. So this is called as a hepatoduodenal part, and this part what you see here is called as a hepatogastric part. This is called as an hepatogastric part. Okay, so there are two portions of the lesser omentum. Now the lesser omentum, after engulfing the stomach, it comes to the greater curvature and it forms a big apron like structure here. Okay, so the big apron like structure which is seen here is called as the greater omentum. So what is this? This is called as a greater omentum. So the greater curvature is attached to most of its part to this peritoneal fold which is called as greater omentum. Okay, greater omentum is also called as policeman of the abdomen. Okay, it is also called as policeman of the abdomen. Because whenever there is any okay, so it is called as policeman of the abdomen. Whenever there is any inflammation in the peritoneal region or in the intestinal region, this omentum goes and covers up the inflammation and it will try to contain the inflammation. So that is why it is called as policeman of the abdomen. So we saw one deformity related to policeman, where you see policeman tip deformity, guys. Yes, where you see policeman tip deformity, in which palsy you will see policeman tip deformity or waiter's tip deformity. Very good, it is Erb's palsy. Yes, Adira, I think yes, you have asked a doubt. Inferior phrenic artery. Yes, inferior phrenic artery is a lateral branch. In the picture it is wrongly marked. inferior phrenic artery is a lateral branch. Okay, so kindly you can change in the picture also. So it is a lateral branch. Fine. So policeman tip deformity. Okay, policeman tip deformity is seen in Erb's palsy. Okay, and claw hand is seen in Klumpke's palsy, which we saw yesterday. Now coming to this greater curvature, the greater curvature is also attached to spleen. Okay, so you know there is an organ called a spleen here. So the greater curvature is attached to the spleen. Okay, by means of this peritoneal fold, which is called as gastrosplenic ligament, which is called as gastrosplenic ligament. So what is this ligament called? This is called as gastrosplenic ligament. It is called as gastrosplenic ligament. Okay, it is called as gastrosplenic ligament. And when you go slightly posterior to the stomach, okay, when you go slightly posterior to the stomach, you have a structure called as diaphragm, which is seen here. So you have diaphragm here. Okay, so you got diaphragm here. So the stomach is connected to the diaphragm. Okay, the stomach is connected to the diaphragm by means of this peritoneal fold. The peritoneal fold which extends from the stomach to the diaphragm, is called as gastrophrenic ligament. So this is called as what? This is called as gastrophrenic ligament. This is called as gastrophrenic ligament. Okay, above the gastrophrenic ligament, the stomach directly contacts the diaphragm. So this is called as a bare area of the stomach. This is called as a bare area of the stomach. Okay, so just above the gastrophrenic ligament, okay, the stomach comes in direct contact with the diaphragm. That is called as bare area of the stomach. So these are all the important peritoneal folds which are seen here. Okay, so just to finish it off, just to sum up, what you see within the lesser omentum is two arteries. Okay, one is the left gastric artery, another one is the right gastric artery. So what are these two vessels which are running within the lesser omentum? What is this artery? This artery is called as the left gastric artery. This is called as a left gastric artery, and there is an artery which runs here, which is called as a right gastric artery, Similarly, two arteries runs in the greater omentum. Okay, along the greater curvature. The two arteries which runs in the greater curvatures are, so this artery is called as left gastroepiploic artery. This is called as left gastroepiploic artery. And this artery which is running here is called as a right gastroepiploic artery. This is called as right gastroepiploic artery. So these two arteries runs along the greater curvature within the greater omentum. And today we saw there is an artery which runs within the gastrosplenic ligament. Okay, so these arteries which supplies the fundus of the stomach are called as the short gastric arteries. These are all called as the short gastric arteries. So these are the peritoneal folds with their arteries running through them. Okay, so when we come to the peritoneal fold here, yes, you can just write the peritoneal folds are the peritoneal folds of the stomach. Okay, the peritoneal folds of the stomach are, one is lesser omentum, next is greater omentum, okay, a portion of the greater omentum above is called as the gastrosplenic ligament. And just above the gastrosplenic ligament you got the gastrophrenic ligament. Okay, so these are all the important peritoneal folds around the stomach. Okay, so if you take the stomach has got lot of relationships around it. Okay, so stomach has got lot of relationship around it. Okay, so we'll just try to draw that diagram here. So stomach has got lot of relationship in it. See, for example, if you see the stomach, okay, so stomach has got a fundus. Okay, and this fundus is related to, okay, and this fundus is related to diaphragm above. This is related to diaphragm above. Okay, it is related to the diaphragm above, and it is also related to the pleura and the lung above. Okay, and it is also related to the liver, left lobe of the liver on the left side. It is also related to the spleen on the left side, okay. And anteriorly you got the costal margins. Anteriorly what you got are the costal margins. Anteriorly what you got are the costal margins, okay. Now you get a space here. This space is called as, anybody, what is this space called as? Yes guys, what is this space called as? This space is called as Traub's space. This is called as, very good Anashwara, this is called as Traub's space. This Traub space is bounded, okay. This Traub space is bounded on one side by the diaphragm, one side by the diaphragm and the pleura and the lungs. The other side it is surrounded by the left lobe of the liver. It is surrounded by the left lobe of the liver, and on the left side it is related to the spleen, and anteriorly it is related to the costal margin. It is related to the costal margin. It is related to the costal margin. Now what is the importance of this Traub space? Usually this Traub space is filled with gas, okay. Usually the Traub space or the fundus is filled with gas. So always when you take a X-ray, okay, in an erect view, you can see a fundy gas shadow below the left dome of the diaphragm. You can see a fundy gas shadow below the left dome of the diaphragm. And when you try to palpate in this area, so you try to percuss in this area. When you try to percuss in this area, you get a resonant note. So whenever you have gas, you have a resonant note here, okay. Below that, when the stomach is filled with food, you will have a dull note below that. So usually the cardiac area, okay, or the fundus area which is filled with the gas gives a resonant note. If there is any tumors in this area, see for example, if there is a tumor in the left lobe of the liver, what is the use of this Traub space? If you have a tumor in the left lobe of the liver, or if you have a tumor in the spleen, okay, or if you have a tumor in the basal part of the lung, this Traub space can get obliterated. This Traub space can get obliterated. When this Traub space gets obliterated, okay, when the Traub space gets obliterated, then okay, then you call that Traub space obliteration for, or you contribute the Traub space obliteration for lot of other conditions like tumors or the growth around the surrounding organs. That is the importance of Traub's space. That is the importance of Traub space, okay. So to add one more point, okay, so if you see the costal margin here, if you see the costal margin here, and if you see the left lobe of liver here, if you see the left lobe of liver here, in between these two, the anterior wall of the stomach lies just immediately below the anterior abdominal wall. So this area you can directly do a gastrotomy puncture. You can directly do a gastrotomy puncture. So this area is not covered by any other organs. This area is covered only by the anterior abdominal wall that lies between the left lobe of the liver and the left costal margin, okay, left costal margin, okay. So this is about the this is about the relationship of the fundus and the nearby areas. Now when you come to one important relationship of the stomach, that is the structures forming the stomach bed. That is the structures forming the stomach bed, okay. So what are all the structures that forms the stomach bed? If you see this picture, you can easily say the structures forming the stomach bed, okay. So here you can see the stomach is being removed, okay. Here you can see the stomach is being removed. This is the part of the stomach, okay. This is the part of the stomach. So they have removed the stomach, and when you remove the stomach, what are all the structures you see behind it forms the stomach bed, forms the stomach bed, okay. So we'll just write down what are the structures that are forming the stomach bed, guys. Yes, I hope you know this. So just to brush up, so structures forming the stomach bed, okay, structures forming the stomach bed. So the structures forming the stomach bed are: one is pancreas, next one is spleen, next one is you've got the left kidney, okay, you've got the left kidney, okay, you've got the splenic artery, you've got the splenic artery, okay, you've got the splenic artery. So you got the splenic artery, okay. So all these structures are present in the stomach bed. You can see all these structures here, okay. So you can see all these structures here, guys. Yes, you can see the pancreas here, you can see the pancreas, you can see the splenic artery here, you can see the splenic artery, you can see the spleen here, okay, you can see the spleen, okay, and you can also see colon which is attached here. So this colon is the transverse mesocolon which is also forming the stomach bed, okay, and so you can add that also here. So all the structures forms the stomach bed, guys. All the structures forms the stomach bed, okay. So transverse mesocolon also forms a part of the stomach bed, okay, also forms a part of the stomach bed, okay. So these are all the structures in relationship to the stomach, okay. So of this okay, the stomach we have done with the gross part of the stomach. Now we are moving into the arterial supply of the stomach. Very, very important. Next three topics: arterial supply, lymphatic drainage, and nerve supply of the stomach is very, very important, guys, okay. So let us see how the stomach gets its supply, okay. So for that we'll just draw a simple diagram so that you can able to understand the blood supply of the stomach. See, if you see the stomach, okay, so we'll just draw the stomach here. So this is stomach. Let us consider this is stomach, okay. So stomach has got a lesser curvature and the greater curvature. So running here is the abdominal aorta, running here is the abdominal aorta. From the abdominal aorta you get a trunk called as celiac trunk. And this trunk, when it comes, it divides into three main branches. Okay. So one branch goes to the lesser curvature of the stomach. This branch is called as a left gastric artery. This is called as what? This is called as left gastric artery. Okay, this is called as left gastric artery. Then there is an artery which is a direct continuation of the trunk of the celiac trunk, which runs behind the stomach in a tortuous fashion, goes to the spleen. So this artery is called as splenic artery. This artery is called as what? This is called as splenic artery. Now the celiac trunk finally gives a branch called as a common hepatic artery. So this is called as a common hepatic artery. So what you get here is the splenic artery, okay, and what you get here is the hepatic artery or the common hepatic artery. This is called as common hepatic artery. This common hepatic artery, when it runs down, it divides into two branches. One is called as an hepatic artery proper, okay, another one is called as an gastroduodenal artery, okay. It gives rise to gastroduodenal artery, okay. So this artery is called as gastroduodenal artery. And this artery is called as a hepatic artery proper. This is called as a proper hepatic artery. This proper hepatic artery, when it arises, it gives a branch to the lesser curvature of the stomach. This is called as a right gastric artery. This is called as right gastric artery, okay. Now when the hepatic artery ascends above, it divides into two branches to the liver, one to the right lobe of the liver and to the left lobe of the liver. This two branches are called as the hepatic arteries, right hepatic artery and the left hepatic artery. So this is the right hepatic artery and this is the left hepatic artery. This is the right hepatic artery and this is the left hepatic artery. And from the right hepatic artery you get a branch to the gallbladder, which is called as cystic artery, okay. Can anybody tell me cystic artery forms boundary of which triangle? Guys? Cystic artery forms, very good, Prithviraj. Yes, it forms a triangle of Callet's. Callet's triangle is bounded by cystic artery on one side, by the common hepatic duct on the other side, and on the other side by the cystic duct. Within the Callet's triangle lies one important lymph node that is called as the cystic lymph node of Lund. All these things yesterday we saw, okay. So this is the course of the hepatic artery, and when the hepatic artery runs, where it runs in the lesser omentum, okay. So hepatic artery runs in the lesser omentum, okay. It runs in the lesser omentum. It runs in the right free margin of the lesser omentum. Okay. So when the hepatic artery runs in the right free margin of the lesser omentum, okay, so let us consider this is the hepatic artery which is running in the right free margin of lesser omentum, and to its right side, okay, one important duct runs. This duct which runs to the right side of the hepatic artery is called as the common bile duct, CBD, common bile duct, and this artery is called as the hepatic artery, and running behind these two structures is a vein which is called as a portal vein. So this is called as a portal vein. These are the three structures which are present in the right free margin of the lesser omentum. Right free margin of the lesser omentum, we'll discuss about that when we come to the peritoneal reflections anyway, but just to have an idea or a relationship here, hepatic artery is related to the bile duct on to the right side, and posteriorly it is related to the portal vein, and all these three structures forms a portal triad, and they run in the right free margin of the lesser omentum. They run in the right free margin of the lesser omentum. Okay guys, yes. So now if you see the lesser curvature, okay, the lesser curvature of the stomach receives a direct branch from the celiac trunk which is called as a left gastric artery, and it receives a right gastric branch from the proper hepatic artery. So the lesser curvature of the stomach receives blood supply from these two gastric arteries, Now what happens to the splenic artery? The splenic artery, before enters the spleen, it gives branches to the fundus of the stomach. These are all called as the short gastric arteries. What are these? These are called as the short gastric arteries. Okay, and from the splenic artery, okay, branches runs along the greater curvature and supplies the greater curvature. These branches which arises from the splenic artery are called as left gastroepiploic artery. Epiploic means it is the peritoneal fold of the stomach. So since it runs within the peritoneal fold of the stomach, it is called as left gastroepiploic artery. It is called as a left gastroepiploic artery. And from the gastroduodenal artery, okay, so the gastroduodenal artery divides into right gastroepiploic artery. Okay, so this is the right gastroepiploic artery arising from the gastroduodenal artery. Okay, so this is right gastroepiploic artery. Okay, so this right gastroepiploic artery and the left gastroepiploic artery anastomoses along the greater curvature of the stomach. Okay, so the gastroduodenal artery, after giving the right gastroepiploic artery, continues as the superior pancreatico-duodenal artery. Okay, superior pancreatico-duodenal artery, and this gastroduodenal artery also gives a branch to the pylorus, which is called as Wilkes artery. Okay, Wilkes artery. So this is called as supraduodenal artery of Wilkes. So the gastroduodenal artery also gives a branch called as Wilkes artery, which is called as the supraduodenal arteries of Wilkes. Okay, when this is about the blood supply of the stomach. So when you take the blood supply of the stomach, so the main blood supply is from the celiac trunk. If somebody asks you from where does stomach develops, okay, you can very well say stomach develops from the foregut. And if somebody asks you what is the artery of the foregut, the artery of the foregut is celiac trunk. So stomach is supplied mainly by the branches of the celiac trunk. So this is about the what is this? This is about the arterial supply and the corresponding veins. Okay, the corresponding veins will drain the stomach and they will drain into the portal vein. Okay, so I'm not going into the details of the venous drainage of the stomach. The left gastric vein, right gastric vein, they drain into the portal vein. The left gastroepiploic vein drain into the splenic vein. The right gastroepiploic vein, they drain into the superior mesenteric vein. So they drain into the drain into the portal veins. My next concern is the lymphatic drainage of the stomach. Very important, lymphatic drainage of the stomach. Okay, so lymphatic drainage of the stomach. Okay, so we'll just draw a diagram, a simple diagram again here. So if you take the stomach, so let us consider this is the stomach. Okay, let us consider this is the stomach. So this is the body of the stomach, and this is the pyloric region of the stomach. So this is pyloric region. Okay, so this is pyloric region. Okay, now I divide the stomach into 4 quadrants. I divide the stomach into 4 quadrants. This is quadrant number A, and this is quadrant number B, and this is C, and the pyloric region is D, and the pyloric region is D. Let us consider, or let us divide the stomach into 4 quadrants. One quadrant mainly occupy the lesser curvature. The greater curvature of the stomach is divided into 2 quadrants, and the pyloric region is kept as 1 quadrant. When you see the lymph nodes around the stomach, you got certain groups of lymph nodes. Okay, the lymph nodes which are seen here close to the lesser curvature are called as the left gastric lymph nodes. They are called as a left gastric lymph node. They are called as a left gastric lymph node. They are called as a left gastric lymph nodes. Okay, they are called as left gastric lymph nodes lying between the stomach and the pancreas is the group of lymph nodes along the greater curvature. So these are called as a gastrosplenic lymph nodes. Okay, these are called as the gastrosplenic lymph nodes. Okay, these are called as the gastrosplenic lymph nodes. Okay, and the lymph nodes what you see along the greater curvature on the lower side are called as the right gastroepiploic nodes. These are called as the right gastroepiploic nodes. Okay, these are called as the right gastroepiploic nodes. Lying below the pylorus are called as the subpyloric nodes. So these are called as the subpyloric nodes. These are called as the subpyloric nodes. Okay, they are called as the subpyloric nodes. And lying around the hepatic artery are this group of lymph nodes which are called as the hepatic nodes. Okay, so they are the hepatic nodes, and lying around the celiac trunk are called as the celiac lymph nodes. So these are all the celiac lymph nodes. So this is the celiac nodes. These are called as the celiac nodes. So if you take the stomach is surrounded by lot of lymph nodes. Okay, so along the lesser curvature, if you see, you got the gastric lymph nodes. Along the greater curvature, you got gastrosplenic nodes. Towards the lower part of the greater curvature, you have got the gastroepiploic nodes. Below the pylorus, you have got the subpyloric nodes, and around the hepatic artery, you have got the hepatic nodes, and around the celiac trunk, you have the celiac nodes. Now, what happens to the drainage of these? See, now if you see, the segment A or the zone A drains into the left gastric nodes, and the left gastric nodes ultimately drains into the celiac nodes. Okay, and if you take the region B drains into the gastrosplenic nodes, and they drain into the left gastric node, and they finally drains into the celiac node. If you take C portion drains into the gastrosplenic nodes. This gastrosplenic nodes drains into the subpyloric nodes drains into the hepatic nodes, and hepatic nodes drains into the celiac nodes. If you take the pylorus can drain in multiple ways. It can drain into the subpyloric region, it can drain into the hepatic nodes also, and ultimately they all drain into the celiac lymph nodes. So if you take all the lymph nodes of the stomach, ultimately they drain into the celiac lymph nodes. Okay, so ultimately they drain into the celiac lymph nodes. But the zone wise, if you see, zone A drains into the left gastric node, zone B drains into the gastrosplenic node, zone C drains into the gastroepiploic nodes, and zone D can drain either into the subpyloric nodes or into the hepatic nodes. Okay, Okay, so this is about the lymphatic drainage of the stomach. Okay, so if suppose there is a tumor in the zone A, okay, what is the lymph node that can get enlarged first? It is the left gastric lymph nodes that will get enlarged first. Okay, so I think with this background, we'll move to the nerve supply of the stomach, guys. Yes, we'll move to the nerve supply of the stomach. So if you see the nerve supply of the stomach, so this is let us consider. So this is the stomach. Okay, so what you see here is the anterior surface of the stomach, and what you don't see just behind the stomach is the posterior surface of the stomach. when you see the anterior surface of the stomach, okay, you can see a nerve which is coming and supplying, okay, you can see a nerve which is supplying the anterior surface of the stomach, okay, that also gives a branch to the pylorus. So this anterior part of the nerve is called as the anterior vagal trunk. This is called as the anterior vagal trunk, okay, this is anterior vagal trunk, and this anterior vagal trunk mainly supplies the fundus. It mainly supplies the fundus, it supplies the body, okay, and this branch is called as the pyloric branch. This is the pyloric branch which supplies the pyloric antrum. It supplies the pyloric antrum and the pyloric sphincter, and the pyloric sphincter, it is called as pyloric sphincter, okay, it is called as pyloric sphincter, okay, it is pyloric sphincter. So this anterior vagal trunk is nothing but the left vagus nerve. It is formed by the left vagus nerve. It is formed by the left vagus nerve, okay, it is formed by the left vagus nerve. Please remember this vagus nerves, okay, this vagus nerve are parasympathetic nerves. They are parasympathetic nerves. They are parasympathetic nerves, okay, they are parasympathetic nerves, and this vagus nerve are, okay, excitatory, or they are stimulatory for the sphincters. They are excitatory, okay, they are excitatory for the stomach musculatures. They are excitatory for the stomach musculature, okay, they are excitatory for the stomach musculature, and they are excitatory for the gastric glands. They are excitatory for the gastric glands. So whenever the vagus nerve gets stimulated, okay, so the gastric glands will have an increased HCl secretion. So increased secretion within the stomach will be done by vagus nerve. So that is a part of parasympathetic supply. That is by a part of parasympathetic supply. So that is the course of vagal trunk. Vagal trunk not only supplies the fundus body and the pylorus, it mainly gives a branch to the pyloric sphincter, okay. So this pyloric sphincter, only when it relaxes, okay, the contents of the stomach can go to the duodenum, because pyloric sphincter is a true sphincter, okay, pyloric sphincter is a true sphincter. Now coming to the posterior vagal trunk, just behind the stomach you get a trunk called as posterior vagal trunk, which gives branches to the posterior surface of the stomach, and it gives main branch to the celiac plexus. It gives main branch to the celiac plexus. So what is this plexus? This is celiac plexus. Celiac plexus receives supply from the posterior trunk of the vagus nerve, posterior trunk of the vagus nerve, okay, and the posterior trunk of the vagus nerve, or the posterior vagal trunk, is nothing but the right vagal trunk. So this posterior vagal trunk is nothing but the right vagal trunk, is nothing but the right vagal trunk, okay. So this is about the parasympathetic supply, and the sympathetic supply for the stomach is by the sympathetic supply of the stomach is by the greater splanchnic nerve. The sympathetic is by the greater splanchnic nerve, okay, which has got the root value of T6 to T9. So this is the greater splanchnic nerve which is supplying the stomach. That is the sympathetic component. That is the sympathetic component, okay. So we have seen about a lot of important things related to the stomach, okay. So we have seen about the blood vessels, we have seen about the lymphatic drainage, and we have seen about the what is called as an nerve supply of the stomach also, okay. When you take the applied aspect, you know ulcers are common in the stomach region, which are called as gastric ulcers, okay, and carcinomas are common in the stomach region, called as gastric carcinomas. And in infants, okay, one condition is very common in infants, in the male child, okay, there is a sphincter here, there is a sphincter in the pyloric region, okay. This is a true anatomical sphincter, okay. So there are two orifices in the stomach. Do you know there are two orifices in the stomach? Yes. Can anybody tell me what are the two orifices in the stomach, guys? What are the two orifices? One orifice is here and the other orifice is here. What is this orifice called as? What is this orifice is called as? Okay, yes, Anashwara, celiac ganglion is supplied by the left vagus nerve. It is supplied by the it is supplied by the posterior vagal trunk. It is supplied by the posterior vagal trunk, which is actually the right vagal trunk, okay. So celiac ganglion is supplied by the posterior vagal trunk, which is the right vagal trunk. Okay, I think that clears your doubt. Yes, yes. So now you see the orifices. There are 2 orifices in the stomach. Okay, so can anybody name this orifice? What is this orifice called as? This orifice is called as what? This is called as cardiac orifice. This is called as cardiac orifice, and this orifice what you see here is called as an pyloric orifice. This is called as an pyloric orifice. Okay, and if you see the pyloric orifice, okay, this pyloric orifice is surrounded by a true sphincter, true anatomical sphincter. That is, here the smooth muscle thickens to form a sphincter. This is called as pyloric sphincter. And if this pyloric sphincter becomes thickened, okay, it results in a condition called as, can anybody tell me what is the condition in infants with thickened pyloric sphincter called as? Very good, Prithviraj. It is called as congenital. It is called as congenital hypertrophic pyloric stenosis. It is called as congenital. It is called as congenital hypertrophic pyloric stenosis. It is called as congenital hypertrophic pyloric stenosis. So whenever a patient has gotten congenital hypertrophic pyloric stenosis, okay, the patient will present with abdominal pain. Okay, the patient will present with abdominal pain. Okay, and the patient will present with non-bilious vomiting. The patient will present with non-bilious vomiting. Okay, the patient will present with non-bilious vomiting. And when you palpate the abdomen, okay, when you palpate the abdomen, you can see a palpable lump in the epigastric region. Palpable lump in the epigastric region. So this condition is called as congenital hypertrophic pyloric stenosis. So they do a myotomy to release the thickened sphincter. They do a myotomy here, which is called as Ramsted's myotomy, okay, so they do a myotomy here, okay, so to release and open out the sphincter. So this condition is called as congenital hypertrophic pyloric stenosis. If there is a congenital hypertrophic pyloric stenosis, if you do an plain X-ray, that will show a sign called as single bubble sign. So that will show a sign called as single bubble sign. So when there is an obstruction at the pyloric level itself, only the stomach distance, okay, so that distension of the stomach can be seen in a plain X-ray, which gives an appearance called as single bubble sign. That gives an appearance called as single bubble sign. Okay, that gives an appearance called as single bubble sign. So that is what we saw. Okay, so with this we have done with the stomach. Okay, so we will go to the next portion of the intestine, that is the small intestine and the large intestine. Okay, that is the small intestine and the large intestine. Okay, so I hope you know small intestine and large intestine very well. So just to touch the important things related to small intestine and large intestine. Okay, so you know that small intestine is divided into 3 parts. Okay, small intestine is divided into 3 parts. Okay, one is the duodenum, another is called as the jejunum, and another one is called as an ileum. So small intestine is divided into 3 parts. Okay, one is called as duodenum, another is called as jejunum, and another is called as ileum. Okay, another is called as ileum. Okay, so we'll just discuss about the duodenum. Okay, so if you see, I don't have space here to write. Okay, I'll just see whether I got anything left here. Okay, so we'll use this space. I'll use this space for small intestine. Okay, so if you take small intestine, the first part is the duodenum. Okay, so duodenum, it measures about 10 inches in length. It has got 4 parts in it. Okay, so the first part is here, and the second part is here, and the third part is here. Okay, and the fourth part is here. Okay, and the fourth part is here, and it continues as the jejunum. So if you take the first part, okay, the first part is 2 inches in length. The third part, or the second part, is 3 inches in length. The third part is 4 inches in length, and the fourth part is 1 inches in length. The entire duodenum is retroperitoneal organ. It is a retroperitoneal organ, except, okay, it is a retroperitoneal organ except the first 1 inch, okay, the first 1 inch of the duodenum, okay, the first 1 inch of the first part of the duodenum, the first 1 inch of the first part of the duodenum is surrounded by the lesser omentum, so that is intraperitoneal, that is intraperitoneal. So if you see in the diagram, okay, so only this portion which is surrounded by the peritoneum is intraperitoneal, rest part of the duodenum is totally retroperitoneal, is totally retroperitoneal, is totally retroperitoneal, okay. So if you see the important relationship of the duodenum, okay, if you see the duodenum, so the first part of the duodenum, the first part of the duodenum, okay, it is related to a foramen above, okay. So the duodenum is related to a foramen above. This foramen is called as epiploic foramen. This foramen is called as epiploic foramen. This foramen is called as what? Epiploic foramen, okay. This foramen is called as epiploic foramen. So that is related superior to the first part of the duodenum, and running behind the first part of the duodenum is the biliary duct, okay. Running behind the first part of duodenum is the common bile duct, is the common bile duct, is the common bile duct, okay. And the second part of the duodenum, as you all know, it is related to the pancreas here, it is related to the pancreas here. What part of the pancreas? It is related to the head of the pancreas, it is related to the head of the pancreas, it is related to the head of the pancreas, okay. And it is also related to the transverse mesocolon, it is also related to the transverse mesocolon here. The anterior side is related to the transverse, it is related to the transverse mesocolon here, okay, it is related to the transverse mesocolon. And posteriorly it is related, okay, posteriorly it is related to the kidney here, okay, posteriorly it is related to the kidney. So you got the right kidney here. So the second part of the duodenum is related to the right kidney also, it is related to the right kidney. And the second part of the duodenum anteriorly it is also related to the gallbladder here, it is related to the gallbladder here. So you get the relationship of the structures around the duodenum in this region. So we don't emphasize much on the relationship, just for completion's sake I am just telling you. Only one important relationship to be noted here is the relationship of the duodenum and the epiploic foramen. So if you see the epiploic foramen is situated above the first part of the duodenum. So you should not forget this relationship. Other relationships are not that important. So just have an idea that there are certain structures around the duodenum, okay. If you see the next part of the duodenum, that is the third part of the duodenum. So this third part of the duodenum is crossed anteriorly by one important vessel, that is called as the superior mesenteric vessels, okay. So the superior mesenteric vessel, namely the superior mesenteric artery and the superior mesenteric vein, they cross anterior to the third part of the duodenum. This is the next very important relationship. So if you see the third part of the duodenum, okay, it is lying between the superior mesenteric artery and the superior mesenteric vein anteriorly, and behind this you have the aorta which is running here. So the aorta is related to the third part of the duodenum posteriorly. So what is the posterior relationship? So on the third part of the duodenum, okay, posteriorly it is related to the aorta. So if I want to draw a section from the side, if this is the abdominal aorta, if this is the abdominal aorta, from the abdominal aorta you get an artery which is coming to the intestine at the level of L1. So this is aorta. At the level of L1, if you see, there is an artery which is running. This artery which is arising from the aorta on the ventral aspect, so this is a ventral branch. Running to the small intestine is nothing but the superior mesenteric artery, is nothing but the superior mesenteric artery. And there is an duodenum which is seen here, a portion of the duodenum which is seen here. This is nothing but the third part of the duodenum. So what is this? This is the third part of the duodenum. This is the third part of the duodenum. This is the third part of the duodenum, okay. This is the third part of the duodenum, okay. See, what happens is sometimes if a child has got a condition, okay, sometimes if a child has got a condition called as congenital dislocation of the hip, okay, or if a child has got an hip dislocation, or if he has got a proximal femur fracture, in a child, these conditions can be treated by applying a spica. Can anybody tell me what is the spica which is used to treat the congenital dislocation of the hip or a proximal femur fracture or an hip fracture in a child? What is the name of the spica called as? What is the name of the spica called as? Anybody? Athira, yes, Pavlik harness is a harness. Okay, so we don't call that as an spica. Okay, that is called as hip spica. Very good, that is called as an hip spica. Okay, so that is called as an hip spica. And have you ever seen how an hip spica is being applied or where it is applied? So usually the hip spica comes up to the umbilical region. Okay, it comes up to the umbilical region. Okay, and then it extends to the leg region. So from the abdomen, okay, so the hip spica extends from the abdomen to the umbilical region, and it extends up to the leg region. So the hip spica is a big POP which extends from the abdomen of the child to the leg of the child. So when you put this hip spica tightly, when the hip spica is applied tightly, okay, when the hip spica is applied tightly, what happens is the child will develop a syndrome called as cast syndrome. So when the hip spica is applied tightly, the child will develop a syndrome called as cast syndrome. Now what is happening in the cast syndrome? It is because of the tight compression, the contents in the abdomen gets compressed and the third part of the duodenum get compressed between the superior mesenteric artery and the aorta. This is called as cast syndrome. This is called as cast syndrome. This is also given by another name called as Wilkes syndrome. It is also called as Wilkes syndrome. So in Wilkes syndrome, the third part of the duodenum is crushed between, very good Prithviraj, excellent. So it is crushed between the superior mesenteric artery and the aorta. So this syndrome is called as Wilkes syndrome, also called as cast syndrome, which is seen when the hip spica is applied tightly. So this child will present with a bilious vomiting. Okay, this child will present with a bilious vomiting. Before we saw one condition which is called as congenital hypertrophic pyloric stenosis, where the child presented with non-bilious vomiting. Okay, but this child will present with a bilious vomiting, severe abdominal pain. Hip spica, if is applied tightly, it can result in this syndrome which is called as an cast syndrome, which is called as an cast syndrome. Okay, so this is about the third part of the duodenum. When it comes to the fourth part of the duodenum, one interesting thing is seen in the fourth part of the duodenum. So that interesting thing is nothing but a ligament which is attached to the fourth part of the duodenum. Okay, the ligament which is attached to the fourth part of the duodenum is called as the ligament of Treitz. Okay, it is called as the ligament of Treitz. Okay, so this ligament of Treitz is usually attached to the junction of the duodenum and the jejunum. Okay, so that when the ligament of Treitz contracts, okay, so what is this ligament? This ligament is called as ligament of Treitz. This is called as ligament of Treitz, and when this ligament contracts, okay, it causes the expansion of the duodenojejunal flexure, and thereby the contents can easily pass through it. But if suppose the ligament of Treitz it's attached only to the notch of the fourth part of the duodenum, its contraction can cause obstruction to the flow of the intestine. Now this ligament of Treitz contains what muscle? Can anybody tell me? The ligament of Treitz contains what kind of fibers? Striated fibers, non-striated fibers, elastic fibers. Okay, can anybody tell me ligament of Treitz contains what are the fibers? Of these three, what are the fibers, or what fibers are seen in the ligament of Treitz? Striated fibers, non-striated fibers, and elastic fibers. So if you see the ligament of Treitz, okay, guys, it contains all the three. It contains non-striated fibers, it contains it contains elastic fibers, it also contains striated fibers. And above it is attached to the right crest of the diaphragm. This is called as ligament of Treitz, which is related to the fourth part of the duodenum. Okay, so when this attached to the duodenojejunal flexure, no problem. It is attached only to the duodenum. Its contraction causes increased angulation and it occludes the outflow of the duodenum. So these are all the things which are related to the duodenum. Okay, without wasting much of the time, we'll just discuss the blood supply of the duodenum. If you see the blood supply of the duodenum, okay, so duodenum is mainly supplied by two set of vessels. One is called as superior pancreatico-duodenal arteries and by the inferior pancreatico-duodenal arteries. Okay, so you all know that there is an artery called as gastro-duodenal artery. Okay, this gastro-duodenal artery, after crossing behind the duodenum, it divides into the right gastroepiploic artery and into the superior pancreatico-duodenal artery. The superior pancreatico-duodenal artery divides into right branch and left branch and supplies the head of the pancreas and the second part of the duodenum. Okay, so what is this? This artery is called as what? This artery is called as superior pancreatico-duodenal artery. This is called a superior pancreatico-duodenal artery. I will just draw a diagram here so that you can understand easily. So this is the duodenum. Okay, so this is the duodenum. This duodenum has got a supply from the gastroduodenal artery. This gastroduodenal artery splits into right gastroepiploic, and what is this? This is called as the superior pancreatico. This is called a superior pancreatico-duodenal artery. This is called as superior pancreatico-duodenal artery. It divides into anterior division and posterior division. It divides into anterior division and posterior division. Okay, now next comes the inferior pancreatico-duodenal artery. Okay, I hope you know there is an artery which crosses in front of the third part of the duodenum. Yes guys, this artery which traverses or which crosses the third part of the duodenum in front is the superior mesenteric artery. Is the superior mesenteric artery. Now this superior mesenteric artery gives a branch to the duodenum which is called as inferior pancreatico-duodenal artery. So what is this artery? So this artery is called as inferior pancreatico-duodenal artery. This is called as inferior pancreatico-duodenal artery. This is called as inferior pancreatico-duodenal artery, and this inferior pancreatico-duodenal artery again divides into two, an anterior and posterior branches, and anastomoses with the superior pancreatico-duodenal arteries. So this pancreatico-duodenal arteries not only supplies the duodenum, they also supply, okay, they also supply the pancreas also. They also supply the head of the pancreas also. Okay, and if you see the gastroduodenal artery, this gastroduodenal artery gives a branch called as the supraduodenal artery of Wilkes. So this is called as supraduodenal artery of Wilkie. Okay, this is called a supraduodenal artery of Wilkie, which is one of the main artery which is involved in the peptic ulcer. Okay, whenever there is a duodenal ulcer which commonly happens in the first part of the duodenum, when it erodes posteriorly, it can erode the gastroduodenal artery or the supraduodenal artery, which is a branch of gastroduodenal artery. Okay, so the duodenum, first part of the duodenum is again supplied by supraduodenal arteries of Wilkie. So these are all the branches, okay, or the blood supply of the duodenum. Okay, so the main blood supply of the duodenum is by the superior pancreatico-duodenal and by the inferior pancreatico-duodenal. And what is interesting in the second part of the duodenum is, okay, we have discussed lot of times this. Okay, so there is a duct which opens into it, that is the ampulla of Vater, which opens into the second part of the duodenum. Okay, so this is called as the major duodenal papillae. This is called as the major duodenal papillae. This is called as the major duodenal papillae, which is situated at the distance of 8 to 10 centimeter distal to the pylorus, which is situated at a distance of 8 to 10 centimeter distal to the pylorus. We have seen that, and just above it is the minor duodenal papillae. Is the minor duodenal papillae. What are these? These papillae are the folds of the mucosal. These are all the mucosal folds. Okay, into the mucosal folds you have the opening of these ducts. This is called as minor duodenal papillae, which is situated at the distance of 6 to 8 centimeter distal to the pylorus, causing opening of the minor or the accessory pancreatic duct. So these are the two important ducts which open into the second part of the duodenum. And when you see the duodenum, okay, when you see the duodenum contains complete mucosal folds. These mucosal folds are complete mucosal folds, okay. So these mucosal folds are complete mucosal folds, okay. So they are called as complete mucosal folds, and these complete mucosal folds are called as valves of Kerckring. They are called as valves of Kerckring. Okay. One important differentiation of duodenum is, see, normally if you take stomach, okay, or normally if you take the pyloric region of the stomach, usually the glands are located in the stomach. If you see, okay, the glands are located in the mucosal region. It is located in the mucosal region, whereas in the duodenum, guys, very important, the glands are situated in the submucosal region. They are situated in the submucosal region, and these glands which are situated in the submucosal region are called as the Brunner's gland, okay. So they are called as a Brunner's gland. Okay, they are called as a Brunner's gland, okay, fine. So they are called as a Brunner's gland, fine. So whenever you see the duodenum, so these are all the important things that are related to the duodenum, okay. So the submucosal glands which are seen in the duodenum are called as the Brunner's gland. The mucosal folds are usually permanent mucosal folds, okay. So they are called as complete mucosal folds. They are called as the valves of Kerckring, okay. So you have got similar mucosal folds in the stomach also, but those are not permanent folds. When the stomach dilates, the mucosal folds disappears, but in the duodenum, when it dilates, the mucosal folds doesn't disappear, they stay there, okay. So they are called as the valves of Kerckring. Okay. So we are done with the duodenum, okay. The next is about the jejunum, ileum and the large intestine, okay. So we'll take a small break here, and after the break, when we come back, we'll discuss about the anatomy of the next part of the intestine, and then we'll go to the urogenital system and to the pelvic region, okay, fine. So we'll take a short break, guys.